Welcome to Radiant Aging, where growing older means growing stronger, healthier, and happier every day. Have you ever found yourself feeling more tired than usual, or perhaps noticing that your body doesn't respond the way it once did? It's a common experience as we age, but one thing that many people don't realize is that some medications, which seem harmless at first, could be contributing to that sluggish feeling. It's easy to assume that medications prescribed by doctors are always in our best interest. But the truth is, as we grow older, our bodies change, and some of these medications may actually do more harm than good. In today's video, we're diving into a topic that can have a significant impact on your health and overall well-being. We're going to talk about 3 medications that seniors should stop taking immediately. Medications that could be slowing you down, making you feel worse, or even causing harm over time. Now, you might be thinking, but my doctor gave me these meds for a reason. How can it be bad for me? It's a valid question, and it's important to understand that your health needs evolve as you age. What worked for you in your younger years may no longer be the best choice now. So, let's take a look at the first medication you might want to reconsider: benzodiazepines. Benzodiazepines are often prescribed for anxiety, insomnia, and sometimes even for muscle relaxation. They include medications like Xanax, Valium, and Ativan. They work by calming the brain and nervous system, helping you feel more relaxed. But here's the catch. While they can provide short-term relief, they come with serious long-term risks, especially for older adults. Studies have shown that benzodiazepines can increase the risk of falls, fractures, and memory problems. As we age, our balance and coordination naturally decline, and taking these medications can make it worse. On top of that, these drugs can impair cognitive function, leading to confusion, difficulty concentrating, and even memory loss. This is something you definitely want to avoid, as it can impact your daily life and independence. Another issue with benzodiazepines is the risk of dependency. The longer you take them, the more your body becomes reliant on them, and stopping can lead to withdrawal symptoms. But here's the good news. There are plenty of safer, non-addictive alternatives for managing anxiety and sleep issues. Things like cognitive behavioral therapy, lifestyle changes, or even herbal remedies. If you're concerned about your anxiety or sleep, it's worth having a conversation with your doctor about other options that might be a better fit for you at this stage in life. Now, let's move on to the second medication that many seniors need to reconsider: anticholinergic drugs. These are often prescribed for conditions like overactive bladder, depression, and Parkinson's disease. They include medications like Benadryl, certain antidepressants, and medications for incontinence. You might be familiar with the feeling of a dry mouth or difficulty urinating, and while those symptoms might seem like no big deal, anticholinergic drugs can cause a host of problems that are often overlooked. For one, they can cause memory problems and confusion, which is particularly concerning for seniors who are already at risk for cognitive decline. These drugs can also lead to dizziness, blurred vision, and even constipation, issues that can make everyday activities feel much more challenging. In fact, research has shown that prolonged use of anticholinergics can increase the risk of developing dementia, which is especially concerning for anyone over 60. If you're taking these medications, it's crucial to have a discussion with your doctor about whether they're still necessary for you, or there are alternative treatments available that won't carry these risks. I know that it can be difficult to think about stopping a medication that's been prescribed to you, but it's important to recognize that the benefits you once got from these drugs might not outweigh the risks anymore. Your health is your most valuable asset, and making informed choices about the medications you take can help you live a longer, healthier, and more fulfilling life. That's all for the first 2 medications to watch out for: benzodiazepines and anticholinergics. But there's one more medication I want to talk about, and it's a big one: NSAIDs. These include over-the-counter painkillers like ibuprofen, aspirin, and naproxen. Many of us rely on these drugs to ease the aches and pains that come with age, but they may not be as harmless as we think. Now that we discussed the first 2 medications, let's talk about why NSAIDs might be doing more harm than good, especially for seniors like you. Stay tuned. Now that we've covered benzodiazepines and anticholinergic drugs, let's talk about the third medication on our list, NSAIDs, which stand for nonsteroidal anti-inflammatory drugs. These include common over-the-counter pain relievers like ibuprofen, aspirin, and naproxen. Most of us have used these at some point, whether for a headache, back pain, or joint stiffness. They seem like a quick and easy solution to those everyday aches and pains, don't they? However, if you're over 60, using these medications regularly could be more harmful than helpful. Here's why. NSAIDs work by reducing inflammation in the body, which is why they're so effective at easing pain. However, as we age, our kidneys and digestive systems become more sensitive. NSAIDs, especially when used over a long period, can put a strain on the kidneys, causing them to work less efficiently. In some cases, this can even lead to kidney damage, which is something you definitely want to avoid. And that's not all. NSAIDs can also irritate the stomach lining, which can lead to ulcers or even gastrointestinal bleeding. The risk of these issues increases with age, making NSAIDs potentially dangerous for seniors. If you've been relying on NSAIDs for chronic pain, it might be time to consider alternatives that are gentler on your body. For example, there are other pain management options like physical therapy, acupuncture, or topical creams that can help reduce pain without the harsh side effects. It's also worth looking into natural remedies like turmeric or ginger, which have anti-inflammatory properties and are generally much gentler on the stomach. When it comes to pain management, always consult your doctor before stopping a medication or trying something new. Your doctor can help you find a safer, more effective solution that will keep you feeling your best without compromising your long-term health. So, to recap, if you've been using NSAIDs regularly to ease pain, it's important to have a conversation with your healthcare provider about safer alternatives. Remember, just because something is available over the counter doesn't mean it's always the best choice for your body, especially as you age. Now, let's switch gears a little and talk about medication that many people prescribe to help manage high blood pressure, diuretics. Diuretics, also known as water pills, are commonly used to remove excess fluid from the body and help lower blood pressure. While they can be very effective in managing hypertension, they also come with some risks that are particularly concerning for seniors. One of the main issues with diuretics is that they can cause dehydration. As we age, our bodies naturally become less efficient at conserving water, and using diuretics can make this worse. Dehydration can lead to dizziness, confusion, and even fainting, all of which can increase the risk of falls. As falls become more dangerous with age, dehydration becomes a serious concern. In addition, diuretics can deplete essential minerals like potassium and magnesium from your body. These minerals are crucial for proper muscle function, including your heart. A deficiency in potassium can cause irregular heart rhythms, which can be very dangerous. If you're on a diuretic, it's important to stay well hydrated and talk to your doctor about monitoring your electrolyte levels. In some cases, a potassium supplement or a change in medication may be necessary to keep you safe. If you're taking a diuretic for high blood pressure, make sure you're also working with your doctor to manage your blood pressure in other ways through diet, exercise, and lifestyle changes. Sometimes medications can be adjusted or replaced with something that's gentler on your body while still keeping your blood pressure in check. It's worth mentioning that not all seniors will experience the same side effects from these medications, and every individual is different. That's why it's so important to have regular checkups with your doctor, who can help monitor your medications and make adjustments as needed. Your doctor should be your partner in ensuring that the treatments you're using are not only effective, but also safe for you as you get older. Now that we've talked about the risks of NSAIDs and diuretics, you might be wondering, what are the alternatives? There are plenty of options that don't come with the same risks, and I'll share some of those with you shortly. But before we dive into solutions, let's take a moment to talk about the importance of reviewing your medications with your healthcare provider on a regular basis. It's easy to fall into the routine of just taking whatever is prescribed without thinking twice about it. But your body is constantly changing, and it's important to stay proactive about your health. Having an open conversation with your doctor about the medications you're taking can help you make better choices and avoid potential health problems down the line. So, take the time to schedule a medication review with your doctor. Ask them about the potential risks of the medications you're taking and whether there are safer, more effective alternatives available. Your health is worth it. Next, let's talk about a few lifestyle changes that can complement your medication regimen, helping you feel better and avoid unnecessary side effects. These small but powerful changes can go a long way in improving your overall health. Stay tuned. Now that we discussed the medications you might want to reconsider, benzodiazepines, anticholinergics, NSAIDs, and diuretics, let's focus on the steps you can take to improve your health and well-being without relying on these medications. Many of these changes are simple, but they can make a huge difference in how you feel, and they work alongside your treatment plan to help you live a fuller, healthier life. First, let's talk about staying active. Physical activity is one of the most powerful tools you have to maintain your health as you age. Whether the daily walk, yoga, swimming, or even gardening, moving your body regularly can help you stay fit, improve circulation, and keep your joints and muscles strong. Exercise can also improve your mood, help with sleep, and lower your risk for chronic conditions like heart disease and diabetes. But I understand that the idea of exercise can feel daunting, especially if you haven't been active for a while. The key is to start slow and listen to your body. Aim for activities you enjoy, so it doesn't feel like a chore. A simple 20-minute walk around your neighborhood can do wonders for your energy and overall health. And don't forget the importance of stretching. Flexibility exercises can help keep your muscles and joints limber, reducing pain and stiffness over time. Next, let's talk about nutrition. What you eat has a direct impact on how you feel and how your body functions. A well-balanced diet rich in fruits, vegetables, lean proteins, and whole grains can provide the nutrients your body needs to stay strong. Pay attention to foods that are high in antioxidants, such as berries, spinach, and nuts. These foods help combat inflammation and protect against cellular damage, which is crucial for aging gracefully. If you've been taking medications like NSAIDs or diuretics for pain, inflammation, or other health issues, you may find that adjusting your diet can offer relief. For example, incorporating anti-inflammatory foods like turmeric, ginger, and fatty fish like salmon can help reduce pain and swelling naturally. A diet high in fiber is also essential for maintaining healthy digestion and preventing constipation, which is a common issue for many seniors. Speaking of digestion, hydration plays a huge role in how well your body functions. As we get older, our sense of thirst can decline, so it's important to be mindful of your water intake. Dehydration can cause fatigue, constipation, and even confusion, which is why drinking plenty of water is essential. If plain water doesn't excite you, consider adding a slice of lemon, cucumber, or a splash of juice to make it more enjoyable. Herbal teas like chamomile or peppermint are also excellent choices for staying hydrated while offering additional benefits like relaxation and digestive support. Now, let's move on to stress management. Chronic stress can wreak havoc on your body, contributing to high blood pressure, heart disease, and even memory problems. Learning how to manage stress is essential for overall health, and fortunately, there are many ways to do this. Meditation, deep breathing exercises, and mindfulness are all excellent tools for calming your mind and reducing stress. Even something as simple as sitting quietly for a few minutes and focusing on your breath can have a calming effect. If meditation isn't your thing, try engaging in a hobby or activity that brings you joy, whether it's painting, knitting, gardening, or playing an instrument. Activities that make you happy can lower stress and boost your mood, helping you feel more centered and relaxed. One last thing to mention is the importance of regular checkups with your healthcare provider. As we've discussed, medications and health needs can change over time, so it's vital to have your doctor review your medications regularly and keep track of any changes in your health. They can help you make adjustments and offer advice on alternative treatments that align with your personal health goals. And don't hesitate to ask questions. Your doctor is there to help you make the best decisions for your health. Before we wrap up, I want to remind you that small changes can make a big difference. It may feel overwhelming at first, but taking one step at a time will help you feel more in control of your health. Whether it's changing your diet, staying more active, or cutting back on certain medications, every positive change you make is a step toward a healthier, more fulfilling life. I hope this video has helped you rethink some of the medications you're currently taking and consider safer alternatives. Remember, it's always a good idea to consult with your doctor before making any major changes to your medication regimen. And most importantly, don't be afraid to advocate for your health. Your well-being should always be a top priority. Thank you so much for watching. If you found this video helpful, please give a like and share it with others who may benefit from this information. And don't forget to subscribe to the channel for more helpful tips and advice on living your best life at any age. Here's to a healthier, happier you, no matter your age. Take care, and I'll see you in the next video.